All of us have suffered with reflux at some point in our lives, and you probably think it's something to do with spicy food, acidic drinks, lying down after dinner, and it's just something you have to live with. It's bad luck. But what if I told you in a way it's actually way more than that, because it can erode your teeth, mimic a heart attack, damage your voice, and increase the risk of pneumonia and cancer? But in another, it's actually so simple to understand and so simple to treat. I'm talking about reflux today in a way you haven't heard before, because not only do I have this crazy contraption to show you, but I'm also a sufferer of heartburn myself. And as a doctor, I treat patients with reflux every single day. And at the end of the day, there's really only two questions. Why do you get it? And how do you stop it? This is meant to be you. So when you swallow, food goes down this tube called the oesophagus, where it makes its way down here into this bag called your stomach. And in this bag, it mixes with this liquid called hydrochloric acid. Now this acid is important for breaking down food, activating enzymes, and killing any nasty harmful bugs. But there's one more part of this incredible contraption that's very important, and that's this. That right there, that's your lower esophageal sphincter, and its job is to squeeze this tube shut to prevent acid going from here back up into here, because the stomach, that's made to hold hydrochloric acid, but the esophagus is not. And there are only 3 reasons that the acid goes from here to here, and if you understand this, you're halfway there to winning. Here's the first one. Anything that squeezes the outside of the stomach will increase the pressure on that gatekeeper lower esophageal sphincter. So think pregnancy, wearing tight clothes, lifting weights, coughing, and even just lying down or bending over can push that stomach upwards. And then of course there's obesity, which is a constant increased pressure on our stomach. Here's the second one. As you can imagine, the more and more full that stomach gets with food and drink and even increased acid production, the more and more pressure that's put on that gatekeeper valve, lower esophageal sphincter. And then there are things that contribute to increasing our acid production. So think things like stress, if you're on certain medications like NSAIDs or steroids, or even Helicobacter pylori infection. And then of course there's having a large meal, which means less space, more acid, and more problems. Now there are a number of classic foods that are responsible for worsening this situation, and I guarantee you I have some that will surprise you and you won't have thought of before. I'll come back to that in a minute, but first let's finish this off with the third and final cause. And of course, if you've got a loose sphincter or one that isn't working properly, then that's going to make the situation a hell of a lot worse too, isn't it? Think of it like having a bouncer who's fallen asleep on the job, where it becomes quite easy to just sneak past him into the club. And there's a number of double whammies that I've already mentioned so far that also affect you in this kind of a way. So think pregnancy, smoking, fatty meals, certain drugs like amitriptyline, anticholinergics and calcium blockers, but there's way more of them. And then there's a hiatus hernia, where the stomach actually moves position sort of up too far a little bit. Think of it like that bouncer. We stick him in the cloakroom and we expect him to do a good job at preventing people coming in the front door. Now, like most people, I suffer with acid reflux every now and again. And I remember how it used to be. It used to be that I'd wake up in the middle of the night with this sort of cold inferno burning in the middle of my chest, and not knowing what to do, I'd rush downstairs, open the fridge, and basically drink a bucket of milk, doing whatever I could to try and quench the burning. But it was like using a garden hose to try and put out a forest fire. It was never going to work. And then there was the horrible taste as the acid comes up and goes to the back of my throat. Horrible stuff. Because think of it like this. Imagine getting battery acid and pouring it on your skin. And you know, a not too dissimilar reaction is happening when the acid goes from your stomach up to your esophagus. You're getting that chemical burning sensation, and that's what gives you that bubbling, that burning, that belching. And if the acid comes up high enough, it can give you that sore throat, even a cough, a bad taste in your mouth, And if you think of all that excess saliva that you start producing, well, that's actually your body's reaction to the situation, because your saliva is actually slightly alkaline, so the opposite to acid, and it can actually neutralize it, but usually not enough. Now, they're horrible symptoms, but they're all normal for reflux. But if you find that you're getting weight loss, difficulty swallowing, persistent vomiting, especially if there's any blood in it, or if your stools turn a black, slimy color, or if you're getting reflux for the first time when you're older, or getting a lot of tummy pain, then see your doctor as soon as possible, because that's not normal reflux. So removing or addressing some of the triggers and problems that we've already come across so far, obviously that makes sense. But rather than just rehash those, I want to give you some concrete, different ideas of how to sort out reflux. And there are really 3 avenues of attack. Now, a lot of this isn't rocket science, but rather than jam-packing your stomach full with 3 massive meals a day, maybe 5 smaller meals might make more sense. Not eating within the 3 hours before you go to bed, and remember to use gravity as a friend rather than a foe. But when I say raise the head of the bed, I don't mean just your head. The whole body has to be raised up with something like a wedge or something that lifts up your mattress. When it comes to food, there are a whole load of classic foods which can upset acid. And I'm sure you've heard of some of them, like alcohol and coffee and spicy food. But have a look through here, because I think you'll find some that surprise you. And if you want safer fruits that won't upset the issue, think melons and bananas. And there are foods which might actually help the reflux, specifically ginger and high fiber foods. Now here's one that most doctors won't tell you about. Your diaphragm is your breathing muscle that sits on top of your stomach and supports your esophageal sphincter. Now this muscle is strong and it basically never gets tired. And if you can take care of it with specific exercises like belly breathing, then it can change your esophageal sphincter from a bouncer to an Olympic champion weightlifter. I'll put more in the description below about these exercises and how you do them. And then there are drugs like antacids act to partially neutralize the acid and reduce its strength. And alginates put a sort of raft on top of the acid, a little bit like throwing a fire blanket on it. And there are drugs like Reni and Gaviscon. They use a combination of these strategies. And by taking them and doing this, they can act really quickly, but they don't last very long. H2 receptor antagonists like famotidine act to sort of turn down the dial on the cells that make acid in our stomach. Beyond this, you have proton pump inhibitors like omeprazole, and these are really the big guns, and they try to almost fully shut down the acid factory altogether. Beyond this, there are other options, like there are operations to try and fix it, but these are very rarely necessary. Make sure to have a chat with your own doctor about what might be the most appropriate one for you. You know, reflux is a miserable symptom, but it's something that most of us, I think, can relate to and say, yep, I know what that feels like. Similar to symptoms like feeling tired all the time, aches and pains, mood swings. We all know what they feel like too, but often they're due to a separate issue that often gets ignored. An issue that affects most of the world, so probably you too. An issue that our healthcare institutions and governments advise we should all be treated for, but it's also an issue that most people don't know about. I'm talking about vitamin D deficiency, something that is running rampant behind the scenes. And if it's something you want to know a little bit more about, then feel free to give it a watch. Thank you very much for watching today. I hope you enjoyed it, and hopefully I'll see you over there.